Morning, everybody. It's the very last day of July. It's hard to believe that it has become August already. Uh, and we're still battling a pretty virulent coronavirus. But we've made it through July and now we'll start facing August. I have my Yorkie in my lap, so at any minute now you may hear a bark or he talks to me by growling. So you may hear something like that. Uh, I've several things to talk about today, so I'm going to get on with it. I want to remind everyone about how testing and quarantine works. There's a myth going on out there, going around out there, that if you get tested, whoops, you have to be quarantined. Well, that's not completely true. If you get tested and it's your choice, you aren't having any symptoms, nor have you been exposed to anyone that has the coronavirus, has tested positive, nor have you traveled to any hot spot or anything like that as an employee, then no, you don't have to be quarantined. But there's a lot of confusion out there. I mean, I'm even hearing it from some staff and even out in the community. So you are kind of the experts in this. We're a healthcare provider. So really, please help the community understand that just the act of being tested, um, unless you show symptoms or unless you have been exposed to someone who is positive, the general community doesn't need to worry about quarantining. So I want to make sure that everyone is really clear about it. It's very confusing, and I know that because it's the CDC guidelines have changed significantly. So just wanted to kind of reiterate that. We are still doing a pretty significant amount of testing. As a matter of fact, today is Friday, and our team is out in Timmonsville, where I live, testing at the middle school there. And Randy gives us updates on how the number of tests are going, and it's quite a volume that they're seeing, and which is good because just yesterday, as reported by DHEC, Florence County, which is where Timmonsville is, had 116 positive cases. So there should be a significant amount of need for testing in Timmonsville and in Florence County. So we're still doing a right good bit of testing. We are a partner with the Department of Health, and you're going to see us do perhaps using DHEC specimen collection kits, doing more testing in our own sites and locations. And maybe less large event type of testing. And that is because DHEC, Department of Health, has received a mandate from the governor that is requiring all of the districts, and our district is the PD district. It's pretty big. It covers a lot of counties, not just our counties, but a lot of counties. And the mandate from the governor says that each district is to ensure that in their county, every county has at least one testing opportunity per week. This is a pretty big chore. Care, South Carolina alone, we have 5 counties. So that means in each of our 5 counties, we need to be able to have some testing opportunity. Now, we actually already do a pretty good job with that because many of our sites, and we have sites in every community, are already doing drive-through testing. So we're going to be working with the Department of Health. They're going to help provide us with the specimen collection kits, which has frankly been our holdup in terms of being able to test at some of our sites. We might not can test someplace because we simply don't have the specimen collection kits from LabCorp, for example. But this will help, and we will do Also, the Mobies will be out there doing testing. We, of course, as you know, I've told you that we have already had delivery of one of our Mobies, and we expect the second Moby to come in at the first of next week. So we'll be using the Mobies, we'll be using our own drive-through testing, which is going very well at many of our sites, and seeing if we can't help out in this mandate for one testing opportunity per week per county. Uh, we have done quite a bit of testing, as a matter of fact. We heard at the Primary Care Association update earlier this week that for all of the testing in South Carolina at FQHCs, that Care South Carolina had performed through July the 10th, 22% of them. We've done a lot of testing. There are 22 FQHCs in South Carolina. Only 90% of all of those are even doing testing at all. And of those that are, only 84% are doing drive up testing. So we're really leading the state. I'm really proud of what you all have been able to accomplish and how well we've gotten a team and are meeting the community needs. We have to keep it up. The coronavirus has not diminished any. I also want to talk about something that I did raise up at the last video message that I did, and that is you're doing a very good job of your personal protective equipment being worn while you're working in sites and social distancing and everything. You're doing a very good job of that. But I'm very concerned about what happens when you leave work. The governor just issued a mandate that had previously only been a recommendation, and now it's a mandate for more mask wearing throughout the communities. Restaurants are now part of that mandate, as are other settings where there will be large groups of people. Masks will become mandated. And we'll watch that. We'll see if this continues and starts affecting other things. We'll just have to see, and it depends. South Carolina is and still remains a hot spot in the nation. Our ability, I told y'all there might be doggies barking. Our ability to contain this virus is not doing all that well. We've had a very sad benchmark that we've reached in our PD area, and that is in our 5 counties, we've had over 100 deaths. That is a sad statistic to have to swallow. So please understand, we have not diminished the spread and the consequences of this virus by any means. As I said last time, I know you're tired. I know you are so ready for things to get back to normal. But I'm afraid that if we don't, and you are part of the we, if we don't remain extra diligent, if we don't remain extra attentive to wearing masks, to staying away from situations that could enhance spreading, to be very careful. I'm afraid that I might be having the same conversation as late as Halloween or even Christmas. Let's don't make that happen. Let's do our job in the PD. Now, the interesting thing about the data that we learned from the Primary Care Association is while the state has a 14 to 15% positivity rate, in other words, of all the tests that are done throughout the state, 14% come back positive. In our case, we're not experiencing but 4 to 5%. Throughout the FQHCs in the state, it's a little bit higher than that. So you might be thinking, well, what does that tell us? What does that mean? There's some speculation around that. We're not really completely sure what that means, but it could mean that we are actually doing a pretty good job of reaching out and bringing in people, assuring that they can get tested to reduce the rate of positive cases in our service area. But we'll see. Stay tuned. There'll possibly be more information available in that manner. I'm going to switch gears now, and I'm not going to talk about the coronavirus. I'm going to talk about a few other things that are going on. Community Health Center Week is coming up, week after next. We've got a lot of things that are planned. I'll be sharing that with everyone, and you've probably gotten emails from Amanda Edelman about events that are going to be going on and our T-shirts that are going to be starting to become available in your sites. If you gave and made sure that Amanda had the correct size of T-shirt for you to get, the theme this year is lighting the way for healthier communities, kind of in a nutshell. And I can really say that that is exactly what you do at Care South. You do light the way. You light the way for people to better health, to better education, to better understanding. You are truly a light in our communities. So, Community Health Center Week, we're also launching a voter registration drive. Marek Calhoun is overseeing that. We're going to be doing some cool and interesting things. Some data analysis revealed in the last elections, the national elections, that healthcare staff were amongst the groups that had the lowest numbers of voter registrations. That was hard to hear because if there's anything that should be apparent, it is that healthcare, unfortunately, is affected significantly by political decisions and those politicians who govern us, both state and federally. So, voting is a huge priority. It is as Dr. Don Berwick at the IHI says, it is a moral imperative for us to vote. If we expect any changes at all, whether it's healthcare, whether it's social justice, whatever, then we must vote. So Marek is rolling this out. We've got a button on our web page, and we are going to be putting out opportunities throughout the lobbies for folks to request assistance or information around voter registration. And we really encourage your help and your support on this. And if you aren't registered, by all means, get out there and get registered because it's very important. Once again, moving to another topic, I want to draw everyone's attention that we are really beginning another push for telehealth implementation. We did an incredibly good job right after the coronavirus hit us, and we did it quickly. It was amazing how quickly Care South Carolina providers and teams pivoted to telehealth. Well, we don't need to think about telehealth as just what we do in an emergency. We really need to add that to our tool belt for how we deliver care. Patients have learned that there's other ways that they can have access to health care rather than just coming into our four walls. And we certainly don't want things to have to be of an emergency before we learn and are competent and are enthusiastic about this very important tool. So telehealth is coming back on our radar screen, so to speak. Dr. Smith is out and about. Um, providers are being encouraged to to really accomplish actions with patients who might be reluctant or whom we might not have had contact with, that telehealth is an opportunity to continue to establish that relationship. We've got another big project that's going on, and this is a really big project, and that is the EHR. We have decided after a search to purchase and to implement eClinicalWorks, ECW. And we have kicked that off. We've got the contract that has been started, approved. We are going to have a consultative group called Blue Novo that helped us in this selection process to now shepherd us through the implementation process. You know, we are very different from many, many organizations. I know FQHCs that have had as many as 4 EHRs since the implementation of EHRs, and we have not. We've had only one. But we implemented that EHR when we were still a paper driven healthcare entity. And some of the things that we did in that implementation were frankly clunky. They required us to figure out workarounds, and they were inefficient and ineffective. So, this is our opportunity to ensure that when the EHR is turned on, which the target is at the end of December, just a few months away, that we have a system that is effective, efficient, and that has workflows that don't require 9,000 different clicks. But that's going to take everybody. That's going to take everybody's input and thoughtful consideration. So I know this is additional work right in the middle of all of this having to go on around the coronavirus. But I am absolutely confident that with the steering committee that we've got in place and the teams that are going to be developed and the consultative shepherding that we'll get from the Blue Novo group, that we can do this and we will end up with an EHR that I'm confident will be much more of an effective tool. Uh, Last week I spoke around the school situation, and this week we frankly don't know a whole lot more than what we knew last week. Most of our districts and our counties are still trying to figure out what they're going to do. It doesn't look like that there has been any finality out of the state in approving any proposals. We know and we hear you about your concerns if your children are going to be you're going to choose between virtual versus on site. We know the rock and the hard spot that you are in. We are very, very mindful of that. As a matter of fact, later on this afternoon or today, Liz Kirshner has done some research, and she has and will be posting for you child care opportunities that are throughout our 5 counties. Uh, we are looking at whether or not there will be opportunities for folks to work from home if they have chosen for their children to participate virtually in school. We haven't, frankly, gotten that figured out yet, because that's kind of a dilemma. While you're working from home, how can you be helping the kids with their virtual schooling? So this is a real issue that we're still grappling with. My main message is that we hear you and we understand, and we don't have all of the answers, but hopefully we'll be able to support what your needs are. Um, the word is hopefully, though. I'm going to close with the last thing to bring up to your attention, and I laugh almost when I say this, but we have a hurricane out there, and that hurricane is Isaias. I actually wrote it down on a little cheat sheet on how to pronounce this. I went on Google and I listened to the folks on the Weather Channel pronouncing it, and it looks like this is a Portuguese Spanish word, and it looks like the consensus is it's Isaias. So Isaias is out there. Um, Isaias might be coming for us. It seems to be a fairly, at this point, what we know about it, a fairly mild storm. It's a level 1 and could be a level 2. We don't know a lot about it. It's moving pretty fast, though, so we will be knowing something hopefully over the weekend. I have decided to go ahead and pull together our storm response task force, the ones that we usually pull together so that we can address any concerns and needs and issues that come up as a result of a hurricane or even a tropical storm, because often that brings a tremendous amount of rain. We'll be having a conversation on Sunday afternoon, and you will remember that anything you need to know, whether any of the storm has produced any consequences at any of our sites, our locations, closures, anything will be on the web page. And in addition, it will also be posted on Facebook. So remember also to stay in touch with your site administrator. I know things go on in your own personal homes and settings as an impact of a storm. Um, the whole key to this is communication. Let folks know what's going on and pay attention as we do our best to inform you of what's going on at CARE South Carolina in response. So I've talked enough. This is a long video. I hope it downloads okay on YouTube. Y'all stay safe. Remember, stay safe even when you're not at work. We need you. The community needs you. Y'all have a good weekend, and let's pray for Isaiah to leave the PD alone. Take care. Bye bye.